Hello, YouTubers, and welcome to Informative News and Talk. The Trump administration has now laid out guidelines to reopen America. However, this time, he's going to defer to the governors to put this timeline in place and decide on when the timeline should move forward. Now, remember the first time he said he had total power, but after a lot of controversy, he has recanted that statement and pretty much allowing the state governors to be actually the authority figure to move forward with this plan. I have a news clip on this, and I want to let you watch it, and then we're going to come back and talk about it. Stay tuned.
Want to get it back very, very quickly.
In an effort to restart the economy, the president is laying out his Open Up America Again plan, something that will be up to each state to follow.
Governors will be empowered to tailor an approach that meets the diverse circumstances of their own states.
To begin the process, guidelines call for areas to show a downward trajectory of cases for 14 days, an ability to treat patients without overwhelming hospitals, and have a testing program for healthcare workers.
Through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing. So phase one begins with all vulnerable individuals, including those with comorbidities, continuing to shelter in place and ensuring that those that first go out into the public are not those that are most vulnerable to bad outcomes in this disease. And then ensuring that we continue to do 6 feet maximum physical distancing in public spaces, continuing to avoid large gatherings and all non-essential travel. For the employers, next slide. Again, if a vulnerable population needs to return to work and cannot be teleworking, there should be special accommodations for all vulnerable populations, as well as options for teleworking. We believe every employee should encourage work return in phases from 20% or 25% to 40% to 50%. And again, minimize all non-essential travel. Phase one continued. Next slide. If the schools are already closed, they should remain closed. All visits to senior living facilities and hospitals should continue to be prohibited. Large venues, including sit-down dining, can only be operated under strict physical distancing protocols and maintaining those 6 feet. Gyms could open if they again could adhere to strict physical distancing, and elective surgeries can resume on an outpatient basis. Phase two. Next slide. Next slide. Again, you have to go through the criteria again of a continuation of another 14-day decline among those criteria that were in the gating. Again, we're asking for all vulnerable individuals shelter in place. We did not put a timeline on any of the phases. We want the governors, with the data that they have, community by community, to be setting up those timelines. Again, we're asking for the public to continue to maximize physical distance. However, we increased social settings to be able to now have 50 individuals, and non-essential travel can resume. Next slide. This is for the employers. We still would like to encourage telework, and the common areas should remain closed or be physically distanced. All non-essential travel for employees can resume, and then again, special accommodations for vulnerable. Next slide. This should be a relief to many of households that have small children. Schools, daycares, and camps can reopen in phase two. Visits to senior living facilities, however, should remain in hospitals prohibited. Large venues can operate, but solely under moderate physical distancing, and elective surgeries can resume on an outpatient and inpatient basis. Phase three. And so phase three, I won't go through in detail, is essentially returning to our new normal with all of what we talked about through all phases, continuing the good hygiene practices, continuing the respect for spaces between individuals, because we know that we still have an issue with asymptomatic spread. I do believe with this plan that we're both confronting the issue of finding symptomatic individuals through our networks with early alert, as well as those who come and present to different hospitals and emergency room with testing and contact tracing, but critically have put in place what we believe is a safety net through asymptomatic sentinel surveillance that is centered around our most vulnerable groups between nursing homes and our Native American people and indigenous populations, and our inner city groups that we know may be in multi-generational households and of unique risk. I'll stop there, Mr.
Okay, welcome back from watching the videos. As we had already covered, there are 3 phases to this reopening program. However, I would like to cover phase 1 because phase 1 has 6 subcategories. And I think these categories are important to cover because, again, the video doesn't really go into any type of detail with these categories, but I just want to touch bases on these categories so you would know. Because at the end of the day, you are responsible for taking care of you. These subcategories deal with guidelines to individuals, employers, schools, senior living facilities, hospitals, and large venues. As far as guidelines to individuals, guidelines to each American citizen. Continue to practice that 6 feet physical distance. Continue to only travel when it's absolutely necessary or essential. Continue to avoid the groups larger than 10. And for vulnerable personnel, people with a number of medical issues, you may want to look at staying at home during phase 1. Okay, guidelines to the employers. Employers, make special accommodations for your vulnerable personnel. And also, encourage teleworking rather than having to come into an office if you are able to telework or provide teleworking capabilities. Schools, since our schools right now are closed, there's no need to put our kids at any type of risk. They recommend that schools remain closed. Hospitals, prohibit going to any type of hospital unless you're going there to be a patient. So avoid visiting hospitals. Don't go there unless it's absolutely necessary, like you being a patient again. Senior living facilities. Our elderly personnel are most at risk. So if you don't have to go there to visit or anything, just make that area prohibited, guys. Don't go there spreading any type of COVID-19 to our senior citizens. Last but not least, large venue areas. We're talking about restaurants or any area where people or a number of people congregate. You must practice your 6 feet distance there. And they're asking all of those places, the people that are in charge of those type of places, have strict guidelines for maintaining a 6 feet distance in large areas or large venue areas. Okay? America, be safe out there as we move towards reopening America. And again, ultimately, at the end of the day, you are responsible for making sure that you are safe during this coronavirus or this pandemic era. I know we're about to move towards opening America again. I know the Trump administration is really pushing this, but take care of yourself, America.